So what is a UTI? Acute cystitis, or a urinary tract infection, is bladder inflammation caused by infection, and it is most commonly caused by bacteria like E. coli from the stool. So who's most at risk for a UTI? Well, let's think like the NCLEX. First are factors that introduce bacteria or increase bacterial growth. Next are any factors that cause incomplete bladder emptying and stagnant urine, which bacteria love. So let's take a closer look. First, female sex. Why? Well, a shorter urethra means bacteria have a quick trip to the bladder. Diabetes also increases the risk because bacteria love glucose-rich urine. And sexual activity and poor hygiene also increase the risk of introducing bacteria. And let's not forget about catheters. Indwelling urinary catheters or cystoscopy procedures are basically an express lane for bacteria to enter the bladder. Next is older age, constipation, prostate issues like BPH, kidney stones, and neurogenic bladder. These all decrease bladder emptying and increase the risk of stagnant urine. So let's talk about UTI findings. You know the classic burning urgency and frequency, also known as dysuria. And this is what clients most often report. But we may also see difficulty voiding. Some clients will even have difficulty starting or completing urination due to inflammation. Next is nocturia, or needing to urinate more often at night. And if the urine is cloudy or has a strong odor, this is a red flag for an active infection. And finally, here's your NCLEX curveball. In older adults, the only sign of a UTI might be confusion or a sudden change in mental status. No fever, no burning, just new onset delirium. So if this occurs, always investigate for a UTI. So here's our first NCLEX quick check. So let's pause and see if you can answer these questions. What urinary symptoms typically occur with UTIs? That's burning, frequency, and urgency, also known as dysuria. What may be the only symptom of a UTI in older adults? Mental status changes or acute confusion.